Next time you go for a haircut, take a close look at the red and white barber pole. You may have taken this decoration for granted, but when you walk past it, you're walking past a piece of history. The pole is a relic of a time when barbers didn't just cut hair, but cut people. That's right, barbers also traditionally served as surgeons, since they already possessed the blades needed to do the job. The red is said to have symbolized blood and the white bandages. Thankfully, surgery has come a long way since then. Surgery's ability to open our bodies, fix problems, and restore a patient to health has saved countless lives. In modern times, our species has grown so powerful that we are even capable of removing essential organs and transplanting in new ones. The sick and injured rely on skilled surgeons and their cutting-edge technology to scan their bodies, keep them unconscious for terrifying procedures, and operate while leaving minimal damage. How did we get from barber surgeons to modern medicine? Let's take a look. The first known surgical intervention occurred about 31,000 years ago in Borneo, an amputation of a person's leg. They survived, living for another 6 to 9 years. But not all ancient surgery was so productive. One of the most popular early forms of surgery was trepanation, drilling a hole into a person's skull. Trepanation is still used today to treat brain bleeds or access the brain for neurosurgery. But in ancient times, it's believed these holes were drilled to let out evil spirits from the mentally ill or those suffering headaches. The belief that surgery treated affliction from spiritual entities was common in antiquity. To be a physician in Sumeria, for example, it was required to learn to identify around 6,000 demons that could be punishing the patient. But nonetheless, ancient cultures made major advances in surgical practice. Surgical tools were developed in ancient Egypt, and also the treatment of infections using naturally antibiotic honey. The Indian surgeon Sushrata developed early cosmetic surgery, plastic surgery, and rhinoplasty. And the Babylonian Code of Hammurabi was the first to require compensation to victims for surgical malpractice. The most influential doctor of antiquity is uncontroversial: Galen, born in the Roman Empire in the 2nd century AD. His pioneering study of how the body works remained the basis that all surgeons and physicians would work from for almost 1,400 years. But he made some major mistakes that were overlooked for all that time. The laws of the Roman Empire limited Galen's ability to dissect human bodies, so he primarily studied apes and pigs and generalized his findings to humans. In the 16th century, Dutch physician Andreas Vesalius founded the modern field of anatomy when he discovered Galen's errors and systematically corrected them. In Europe during this era, surgery was generally looked down upon. Surgery killed a huge number of the people it aimed to save, and without anesthetic, it was nightmarishly painful. Physicians at the time considered themselves above surgery, hence the rise of barber-surgeons. Things began to change in the 1840s with the discovery of ether, chloroform, and the medical application of nitrous oxide. Although general anesthetics, compounds that induce unconsciousness, had already been used, Chinese historical texts date the invention of general anesthetic to the 2nd century AD, when the physician Hua Tao was recorded using an anesthetic named mephason. However, what mephason actually was has been lost to time. The first historically detailed use of a general anesthetic was in Japan in 1804, when a surgeon created and used one to perform a mastectomy to remove breast cancer. With anesthesia, surgery could be feared less, and more complex operations could be performed. Yet rather than decrease surgical mortality, it increased. A Viennese obstetrician named Ignaz Semmelweis figured out what was going on. He realized that the then-dominant miasma theory, that infection was caused by so-called night air, was wrong. Instead, something infectious was being transferred from doctor to patients. Semmelweis instituted hand-washing at his hospital, drastically reducing mortality. but the medical establishment dismissed his theories entirely. Semmelweis suffered a nervous breakdown after being mocked, was committed to an asylum, and, ironically, died from an infection after being beaten by the guards. It wasn't the first time this knowledge was ignored. African surgeons had already known that hand-washing and alcohol sterilization reduced mortality, but prejudice led Europeans to reject information from African sources. Finally, in the 1860s, British doctor Joseph Lister confirmed the germ theory of disease. His groundbreaking work led Western surgeons to finally wash their hands, wear gloves, and sterilize their equipment. Antisepsis, the eradication of infectious microorganisms, saved an enormous number of lives. To see what was in the body before cutting it open was the next great advance of this era. X-rays were first discovered by German physicist Wilhelm Röntgen in 1895 and quickly applied for medical use. Today, these three monumental advancements from the 19th century, anesthesia, antisepsis, and imaging, have continued to improve. In addition to X-rays, we now have CT scans, MRIs, and the ability to put cameras directly into the body. Antibiotic drugs such as penicillin further reduced mortality from infection. If you've had surgery, you were most likely put under with modern anesthetics such as propofol or a fluorine gas, although nitrous oxide is still in widespread use. Machinery has also advanced what surgeons are capable of. Laser surgery has enabled less bleeding and shorter recovery times, and computer-assisted navigation allows a surgeon to improve their accuracy. You could even use such computers to like this video and subscribe to Beyond Now. Despite all this progress, surgery remains risky and limited in what it can accomplish. We're far from the finale of what surgery could look like. 3D printing is increasingly being used to create implants, such as titanium replacement hips. In time, 3D bioprinting may even be able to print complex organic matter for transplant. Robots have been used to assist in surgery since Arthrobot in 1983. Today, the Da Vinci surgical system is widely used to give surgeons better control of their instruments. Future developments in robotics and artificial intelligence promise to hand over more control from fallible humans into digital hands and perform surgeries completely autonomously. For the time where we still have humans, alternate reality technology is being developed to overlay information onto a body while a surgeon is operating, taking computer assistance to the next level. Tele-surgery can allow surgeons to operate a robotic surrogate from anywhere, and virtual reality simulations are being developed to help better train surgeons before it's time for the job. Surgery has come a long way from its ancient origins. Our species has moved from regularly harming those we sought to help while putting people in agonizing pain to accomplishing surgical interventions few could have dreamed of just a few decades ago. What we may be able to accomplish tomorrow could too go far beyond what we are capable of imagining. Would you trust a barber with your surgery? And would you dare to undergo any procedure without anesthesia? Join the conversation and predict the future with us down in the comments. At Beyond Now, we seek to help humanity learn from our past and prepare for our future by studying the subjects that can allow our species to advance. In addition to liking, commenting, and subscribing, we hope you'll also consider supporting Beyond Now by becoming a patron and part of our community of learners and thinkers.